Mike, something's not right. I've been so tired. I've been exhausted even after a full night's sleep, and look at my ankles. They're so swollen. I'm also seeing bubbles in my pee. I know it doesn't happen for everyone with diabetes, but I read that might mean my kidneys aren't working right.
That sounds serious. Let's get you to the doctor to see what's going on. It's better to catch it early.
You're right. I don't want to wait until it's too late. So here's the update from my appointment. The doctor says I have chronic kidney disease, or CKD. It's advanced, but if it gets worse, I could end up on dialysis. He started me on some new medications, but they might not be enough on their own. He also mentioned that I could be a candidate for a clinical trial. We're starting the new medications now, and in 3 months, I'll check back to see how everything is working. So the doctor said that the medication has helped my type 2 diabetes, and my labs are now under control. It's great news, but my kidney function is still slowly worsening. My doctor is suggesting I consider this new clinical trial. It's studying a potential new treatment called rilparencel.
Wait, a clinical trial? Are they going to experiment on you the way they did in the Tuskegee study? I heard it really hurt people and was unethical.
That's what I thought too, but the doctor explained things have changed. Clinical trials now follow strict rules to protect people. The study team monitors every patient for safety. I'd be monitored the whole time.
What's involved exactly? What would they do to you?
They would start with doing a kidney biopsy, which means taking a small sample of tissue from my kidney. Cells from the tissue are expanded in the lab and later injected back into my kidneys. This procedure is meant to help delay the worsening of the disease. However, there's also the possibility of being placed in a sham group. Patients are randomly placed in the test treatment or sham group. Participants in the sham group are treated similarly to people in the test treatment group. If I were placed in the sham group, I would not get the biopsy or get the potential new treatment. Instead, I would undergo simulated procedures. Doctors use sham groups to compare the effects of the potential new treatment against the standard of care. It helps them understand if the rilparencel treatment is truly effective. If I were placed in the sham group, I would undergo the simulated procedures. This helps ensure that any improvements in kidney function are due to the rilparencel treatment and not the standard of care. The sham group gets regular visits, monitoring, and the standard of care for patients with kidney disease. It's even been beneficial for some patients to have such close monitoring because there have been past examples in other clinical trials where doctors were able to discover other health issues because of their enrollment in the trial.
Thanks for that info. Do you know what are the risks of the trial?
Let me see what I can find out in my appointment with Dr. Johnson. Dr. Johnson, I've talked to my family, and they had a lot of questions. I need to know, what exactly are the risks? What will this process look like?
Of course, Lauren. First, let's talk about the kidney biopsy. You may be sedated or will numb the area, and the procedure is about 30 minutes. There is a risk of bleeding at the biopsy site and will also restrict some of your physical activity. We monitor you closely for at least 6 hours, then you go home afterwards.
And what about the injections?
The injections are similar. We use a needle to deliver the cells into your kidney. We use a CT scanner as a guide to make sure we are as accurate as possible. You might feel some pain in your back, but most participants recover quickly. Again, you will be monitored closely, and we will do a few tests to track your progress before you go home.
How often would I have to come in?
After the biopsy and 2 injections, you'll have follow-ups, then regular visits every few months. If you decide to enroll, you'll get a detailed schedule.
And what if something goes wrong? What if I decide I can't do this anymore?
You can quit at any time. If anything happens, the trial covers any medical expenses related to the trial. Your safety is our top priority.
Grandma, you said they take cells from your kidney and inject them back. How do they know that'll work?
Rilparencel is still a test therapy, so they do not know it will work. However, they've done previous studies, and the results were promising. It helped stabilize kidney function in some people.
What about side effects? What if it makes things worse?
They've been upfront about that. Possible side effects include soreness in the back and sometimes bleeding around the kidney from the biopsy or injections. But they have safety measures, and I'll be monitored every step of the way.
Why did they pick you? Are you sure this is right for you?
They said my worsening kidney function and diabetes make me an ideal candidate. They're focusing on people with advanced kidney disease before they've started dialysis or received a kidney transplant.
Will they pay you for participating?
Yes, I will be compensated for each visit, and they'll also cover my travel. And if anything goes wrong, they'll handle the medical bills.
Well, if this could keep you off dialysis and help others like you, maybe it's worth it.
I've thought about it a lot. It's a chance to help others in our community who face the same problems with their kidneys.
I'm so proud of you. Your participation could help develop a new treatment that could help other people delay going on dialysis. If you're ready, we're behind you 100%. You're setting an example for all of us.
Chronic kidney disease affects people in the United States and around the world. In the United States, 37 million adults are estimated to have chronic kidney disease, and most aren't aware of it. 1 in 3 American adults is at risk for CKD. Risk factors include diabetes, high blood pressure, heart disease, obesity, a family history of kidney failure, and being age 60 or older. People of African American, Hispanic, Native American, Asian, or Pacific Islander descent are at increased risk for developing CKD, but we all should be aware of our risk and help advance new treatments that will help everyone. By joining this trial, I'm taking control of my health and helping develop treatments that can help people stabilize their kidney function and stay off dialysis.